obviously, let's talk about the lumbar spine. Surgeon says come on in for an AP. So let's walk through the entire process from approach to getting that perfectly displayed image on the screen. So when I get ready to approach the field, I'm coming up to the level of the anatomy that I feel, and I'm perpendicular to the patient. I will then set my boom arm approximately halfway. Just gives me some room to push in and out if I misjudge my approach. So here, I'm coming in for what I hope to be centered on L3, because I want to try and get as much of the anatomy in as possible. So I'm going to drop my height to increase my field of view. So I'm not expecting this to be perfect, so let's go ahead and take an image there. So you can see I am seeing too much of the patient's right side. So what I have to do is move my field of view over to the left side of the patient to bring the spine midline. So because I have my boom, I don't have to move my base. So I'm going to guess probably about 1.5 to 2 inches. So we'll take a picture there. So now our spine is much more in the 12 to 6 of the screen. So we see the full length. With this, we can see T12, the last rib, just at the top of the screen. So we have L1, 2, 3, 4, 5, and some S1. Now, if we look at our spinous processes, you can see that they are leaning off to a side.
With the patient laying in a prone position,
if the spinous process is pointing to the left side, as in this case here, that is pointing away from me. So to correct for that, I would rotate my C-arm externally or apply a few degrees of overscan to center this up. So using my C-lock, we'll go ahead and rotate maybe about 5 degrees, and let's see what this does to the image here. So that's straightening them up, but again, because I'm below the fulcrum, you can see that when I apply the rotation, I am also moving the anatomy. So I have to add a little bit more overscan, and then I probably want to pull my boom back a little bit as well. So let's go ahead and apply a little bit more rotation, because the spinous process is still leaning a little bit towards the left. And now I will bring that boom in back a little bit. Take that picture there. So now you can see your spinous process is much more centered, and here we're looking at L3. I could probably bring it back a touch more, just to go ahead and get that real centered. Oh, too much. And the reason you want it in the center is you just get better penetration of the body part. So here we have a nice spinous process demonstrated in the center. Now, if we look at the top end plate, we're kind of seeing a little bit of a double shadow. So also we want to now apply a little piece of tilt onto this, trying to shoot straight down that top edge of the vertebrae. Now, I'm looking at my height. I'm very close to the patient. So I want to raise up a little bit. And I'll go ahead and apply some tilt. Which way is it? We don't really know, but if we think of the curvature of the spine, we probably want to apply a little piece of cephalic tilt. So let's go ahead and see if that makes a more solid black line. And it's flattening out a little bit. Put on a little bit more. And it's there. Now you can see it's opening up. So we want to come back a little bit, because we're looking for a solid black line. Sometimes you have to go the other way to confirm that your correction is correct, or to go so far that you can definitely see that it is not the right way. So here we can actually see a better alignment of the bottom. And whichever one, it doesn't matter, top or bottom, because your body is essentially centered anyway. So here we just want a little piece of tilt, or a little bit more overscan, just to bring that spinous process leaning back into the center. And there we go then.